Well, good afternoon, everybody. Welcome to the Manna Institute webinar for October. My name is Dr. Dan Wadsworth. I'm an academic here at the University of the Sunshine Coast and a postdoctoral fellow at Manna Institute. And I'm going to be moderating and participating in today's session. Before we start, I would like to do an acknowledgement of country. Manna Institute respectfully acknowledges the First Nations peoples as the continuing custodians of this continent and pays respects to elders past, present and emerging. The Institute honours their rich cultural heritage, beliefs and enduring relationship to the lands and the communities in which we all live, learn and work. Today I come to you from the Gubbi Gubbi country on the Sunshine Coast, and please feel free to mention in the chat where you're joining us from. Manna Institute is a virtual institute formed by regional universities network, also known as RUN. The RUN network is made up of 7 universities, which are the University of New England, which is our lead university, Federation University, CQU, Charles Sturt University, Southern Cross University, the University of the Sunshine Coast, and the University of Southern Queensland. Our foundation partners are Everymind, Lifeline Direct, and the Centre for Mental Health Research at ANU. At Manna Institute, we've got some of the leading researchers and industry partners who are working with rural, regional and remote Australian communities to improve their mental health and well-being. Importantly, we work closely with both First Nations peoples and those with lived and living experience of mental ill health, and we recognise the invaluable perspectives that they bring to our work. Manna supports meaningful research, but we also foster the development of professional workforces and translate research findings into practical, place-based programmes. For those of you who might have come to one of our previous Manna webinars, today's is a little bit different. We're going to be hearing all about the health and wellbeing and later life research stream, which I co-lead. We'll begin with an overview of the stream. We'll reflect on some of our core values and some of the key individuals that guide our work, and we'll provide a research snapshot of what we've done so far and what's to come. Today, joining us in this conversation are Associate Professor Belinda from Charles Sturt University and Paul Klotz. And they are the 2 other individuals who are key to leadership and direction of this stream. And I'm going to invite firstly Paul and then Belinda to give a brief introduction of who they are. So Paul, briefly over to you.
Thank you, Dan, and good afternoon to all. How does one describe oneself? I suppose the easiest way to do it is that I consider myself a journeyman now, in that I bring my lived and living experience from a number of fronts. I've been fortunate enough to live a very rich and full but very complex life, and so I bring that lived and living experience from a period of intense childhood sexual abuse, mental illness, suicide prevention, homelessness, drug addiction, disabilities. And so I try and utilize all of those experiences that I've gone through to actually make a difference out there. So that was, I suppose, one of the key factors in me being part of this team. Thank you.
Thank you, Paul. Belinda.
Thanks, Dan. I'm Belinda Cash. I'm a social worker by professional background. I work here now as an academic at Charles Sturt University, coming to you today from our beautiful Albury campus on the lands of the Wiradjuri people. My background is as a clinical mental health social worker. I worked in rural and regional areas of Australia, delivering direct clinical practice to people living with mental health conditions. But for the past, well, my twins turned 17 last week, so I can almost pinpoint it down to the time of year that I started the transition into academia. And so primarily I research into mental health in rural areas and particularly looking at the experience of people in later life. I'm very interested in the experience of providing care and the way that people age. So that's sort of what directs a lot of what I do these days.
Excellent, thank you both. If you have any questions as we go along, please feel free to use the Q&A element of Zoom. And if you've got any broader comments, for example, such as where you're joining us from today, then pop those in the chat as we go along today. I'm going to lead the chat. As I said, I'm an academic here on the University of the Sunshine Coast. My research interests lie around health and wellbeing across the lifespan, with a particular focus on older adults. And essentially, my research is aiming to try and help older adults to do what they want to do, where they want to do it, for as long as they want to do it. And it's all about maximizing those healthy years of life. The life in your years, not the years in your life, I guess. And so we'll open up the discussion today with a little bit of an overview of the health and wellbeing and later life stream before profiling some of the work that we do and the reasons that we do it. If you go and visit the stream site on the Manna webpage, Thank you, Liz. You can see we have formed a narrative, and that narrative took the three of us, with some input from some of our other stream members, a little bit of time to formulate and to wordsmith down in Albury Wodonga, maybe 12 months or so ago. And we came up with this narrative that we think encompasses what we want to do as a stream, which is to focus on enabling and supporting health and well-being in later life through promoting physical, social, cultural, cognitive, and psychological aging well. We think that this holistic perspective of aging acknowledges that there are individual contexts, and it recognises things like the impact of chronic disease or disability in later life, and that aging well might mean different things to different people. Importantly, we embed lived experience, and you've already met Paul, who really is fundamental to that. And our research prioritised working in partnership with regional, rural and remote communities to navigate barriers and maximise the strengths through a place-based positive approach. Belinda, as my co-lead of the stream, is there anything else that you wanted to add in the way that we run the stream?
I don't think so, Dan. I think you captured it really well. For me, that kind of multiple perspectives way of us all coming together is really the key thing. It's the beauty of gerontology, really. The beauty of aging is that it's not something that just one discipline can have a view on or input into. And so I think what I really love about this is that there is space for so many different perspectives of looking at how wellbeing is understood and how differently that looks. And we know that so many things right across the life course are going to impact the way people experience aging in later life. And so I think that the breadth that we've been able to encapsulate and all of the different members that have become a part of this research stream, it's been a really lovely thing to be able to maintain that kind of holistic understanding of aging and wellbeing in later life.
I think the only other thing that I would probably add on what you're saying relates to how much we've grown this stream as a collaborative over the past 12 months or so, from some little pockets of research to a collaborative stream. We've probably got 15, 20 members now. And I think that one of the things that really stands out for me across our stream is the idea of capacity building and knowledge sharing as well. You know, we'll touch in a bit on the lived experience side of things, but I think we see that in our stream across the levels of academia as well. And, you know, we've reflected on this in Manna as a whole, and I think we really feel it in this stream. When you're in a meeting, there isn't a hierarchy. Everybody's on that level playing field and everyone's got a voice. But we really do feel that we want to build capacity. So we've got some senior researchers in the stream who are very generous with their time, and we've got some fantastic HDR students as well as people in between. And, you know, we really want to use this stream as a vehicle to build capacity for health and wellbeing research in rural areas.
I think that itself, Dan, if we look back, Paul, to those very early discussions, it literally was the three of us and two HDR students who had, you know, an interest in aging and mental health. And so we those early discussions really did start with just us, really. We were kind of trying to form that narrative around what do we want this to be? Where is this thing going to go? And I think that really, today's conversation for me, it highlights the importance of how having you there, Paul, I guess, right from inception, right from that very early seed of this stream starting to develop, it shaped it, I think, in a way that wouldn't have happened if it had just been academics sitting around the table. And I think the HDRs were another perspective very much around that as well. Like, when you're not kind of coming with a predestined set of this is my research agenda and this is where I'm going, which I think would have steered this ship really differently. It would have, you know, if it was just kind of Dan and I there. And so I love that we've been able to grow and to evolve this thinking about, well, who are the people coming up next and who's working in this space now? And what do you think about this, Paul? How might that look in the real world? Is this actually something people will be interested in, and being able to shape the stream, not just the projects, you know, but the direction of the stream, I think, from that really collaborative kind of conversation was, I don't know, it's been a real highlight for me. It's something that I really valued, I think, and has changed the direction and has really helped us to keep this, you know, heading in that partnership kind of way. It's never really been something that just started with lots of different single streams of things. It grew together.
I think even before this stream was a thing, we had some Manna planning days 18 odd months ago. And Belinda, you and I grabbed hold of Paul pretty quick. And I remember
he didn't stand a chance
to the table and saying at the time it was the have a later life, chronic disease and disability stream. And Paul came over to the table and said, well, I've got all three of those hats, so you guys need to talk to me. And yeah, we haven't let you go since, Paul. So, and it leads me on really nicely to the first thing I wanted to talk about, which is the role that you bring to the team, Paul, which I agree with Belinda. I think it's invaluable. It's, for me, probably the single biggest benefit that I get out of Manna is connection to expertise like yourselves and keeping us all grounded and focused. And Paul, can you, if you don't mind, share a little bit on your reflections on what you give and what you get from being a lived experience expert involved in developing and advancing our stream and keeping Belinda and I on the straight and narrow?
Sure, thank you, and thank you for the kind words. It's always nice to receive those things. I mean, for me, it goes back to that word that I said about being a journeyman. It is a journey. So from a personal perspective, it's very cathartic for me. As I said, yeah, I have a complex background. I'm an older person. I live in regional areas. So for me, having to navigate the health system is quite difficult out there. So it's very cathartic for me to actually learn from you people as well as to what you see the challenges are, and allowing me to learn what some of the stumbling blocks are. I then counterbalance that by saying, well, in a way, I see part of my role is to flip the dynamic that exists there. It's to, if you like, challenge the norm, challenge the myths that may exist out there. It's allowed me to challenge you in terms of, asking you the key questions, which I did very early, is, why are you conducting this research? What are you hoping to get out of it? What are the outcomes? What are the results? Where is this paper going to land? Is it going to land on the right policy people's desks so that we can actually make real and sustainable change? That was a very powerful and cathartic exercise for me, having the ability to influence, not just waiting for the health system to come to me or to be able to help me. I'm actually helping the health system to help me. It also allowed me to challenge you guys, but also challenge my own understanding of what the biomedical model is. And when we look at it from both the physical and the mental health side of it, so much of it is geared around that, and it sits in silos. And you both use that word about collaboration. It's something that we desperately need within the health system, but also all the other departments that exist out there to be able to support us as we go through. So being able to actually understand why it's there, but then say, okay, so what other models are out there? And then for me to be able to apply my own lived and real experiences on why it works, why it doesn't work, what are the potential impacts. So yeah, it was great because in a way I'm a counterbalance to you guys on that litmus test, that sounding board. You say, hey, we're thinking of doing this, and I go, yeah, but hang on, what about blah blah blah? And so that starts a whole new conversation. And I can recall very early on the three of us sitting there, and you two went, you know what? I think we need to park this. We need to rethink this whole project from ground zero, because hey, we've got a whole new perspective. So that's very encouraging, and that's one of the values of bringing living experience, because we are that litmus test that allows you to think about what it is. One of the other benefits, what for me, was that right from the outset, and this is such a key thing when you involve living experiences, that I was brought in right from the outset. So pre-co-design, all of those things, even though you had formulated ideas, it was still at that embryo stage. So for me, I felt valued as a team member in saying, okay, we value your input. And that's one of the critical components, is recognizing, acknowledging the role that the lived and living experience person does bring. So for me, it sort of allowed me to feel as though I was contributing to the project. And that's a key thing for lived and living experience. Whatever your journey is, one of the things that when life throws different hurdles at you is it challenges you to redefine what your purpose is. And for me, it took many years to find my voice, for many years for me to find that purpose. So being engaged in projects like this is a win-win situation, because I'm helping myself, but as I said, at the same time, helping hopefully to change the systems and services that support us out there. So yeah, in a few quiet words, that's what I got out of it.
Thank you, Paul. It's so good to hear that it's a win-win, because I know we certainly feel that it's a win. But to hear you reflect on the sense of purpose it brings you is fantastic, because we know how important that is to individual health and well-being.
Yeah.
Belinda, what does it mean for you to have Paul embedded as a member of our stream?
It's meant everything. I think it's really changed who I am as a researcher, I think. And I think that that's been the real value in the conversations we've had, the openness and the trust that I think we have, amongst the three of us, that we can have difficult conversations and we can push each other to be better. And I think, Paul, the conversations that you've had, and I don't think you're ever, when I say critical, challenging questions, I don't mean in a kind of a way that it's fundamental about it. It makes me go back and think, why did I just automatically assume that this was the way that it should have been done? And because, that auto thinking as a researcher, as a Western kind of way of thinking about research is often that at the forefront of our training. And so I love that. I think before I came to Manna, I used to think that I was doing okay with the lived experience stuff, and I realised how tokenistic, and it wasn't intentionally tokenistic, like I genuinely thought that I was doing good things around trying to embed experiences, but it's really, I think, having these early conversations and the opportunity, Paul, to bounce. I know I do it to you all the time. I'm so sorry that I've got this idea. You must sit still for a second and let me talk about this. It kind of stops me from just running away, I think, with developing research ideas. You're the first person, when I kind of think, would be a great idea. I wonder what Paul thinks about that. And so that kind of ability to have somebody who has really pushed my thinking to practice building in lived experience expertise in a proper, meaningful way, long before the projects are developed at the development of the stream level. It's making me a better researcher. And I think that's, very selfishly, one of the things that I've really gotten out of it is I feel like I've been pushed and challenged to grow. It's forcing me to encounter the behaviours that I thought were good enough in co-design and in collaborative kind of practices. And it really made me realise that there is so much more that we need to be doing, and to actually bring that to life and to have better research as a result of it. And amazing, I've got the A team to end all A teams here. And so you kind of go, I think that the happiness that brings me, my satisfaction at work, so many things have improved as a result of the opportunity to work so closely with you, Paul and Dan, I think, as this stream has evolved.
Could I just add to that? Sorry.
No, go for it, Paul.
The other thing that just popped in my head is that one of the benefits of this, and it goes back to that word collaboration again, and how we've all acknowledged that there are silos that exist out there. When I say silos in this context, it's academia, it's clinical, it's policy, it's government. And one of the things that I've benefited from is I'm learning more about those things, because we're all bringing a level of insight and knowledge and experience, which is helping us to challenge. So one of the win-wins is that hopefully what we will achieve at the end of all this is that we're actually building bridges across the chasms that exist across all of those silos out there. And I think that's a key takeaway for all people, is that, when you're doing research, no matter who you involve, you got to ask those questions: who, what, when, why, etc. But really focus on the silos and what bridges are you actually going to build across each of those that's actually going to improve the overall impact. In this case, for older people, as they go into those grey years, how do we make their life more enjoyable, increased well-being, and a greater sense of purpose?
And Paul, we heard earlier on about how you've helped give us a steer not only on projects but on the theme narrative. And for me, I love that it extends to things like the imagery that we're using to represent a theme. We've picked your brains on that, the name that we even called the theme in the first place, but even down to tapping into your professional brain from business and some of the practice that you've brought across and said, when I was doing this role, this is something that we used to do to help drive a big team or to bring people together. And, I think that's been really valuable as well. Those insights haven't just been limited, shall we say, to your lived and living experience. I'll move us along if I can, and of course we'll keep everybody in the conversation, but to give a bit of an idea of what we have been doing from a research perspective this year, and since the establishment of the stream. We've got a collaborative project example that we're going to talk about, which is called the ROAM project, or the Rural Older Adults Mental Health Project. And I think we came up with the concept of this, Belinda, fairly early on in Manna, didn't we? It's probably one of the things that underpinned the success of the stream because we had that common point for you and I to think, okay, we can see somewhere that we might be able to begin to work together.
Mm-hmm.
And Paul has been instrumental in how we've developed and explored that program. And the idea of this project is essentially to extend that giving of voice and platform to older adults and their carers of older adults living with or having recent experience of poor mental health in rural Australia. We went about this project thinking that we were going to go into it by running some focus groups, and we very quickly learned that it wasn't going to be focus groups, it was going to be one-to-one interviews. And I think one of the more surprising things actually is that everybody was more than happy to be interviewed as we're meeting today. We'd budgeted for travel and transport and we didn't need it. People wanted to meet in this place. And I think that said something to me about how we provide mental health support and how we navigate some of the issues of visibility of that mental health support through, being able to access some of those services and supports in the comfort and privacy of your own home is perhaps a more valuable thing than we think. Belinda, did you have any reflections or comments on this project today?
No, only to, I guess, touch back on the point that you raised earlier in just how much the shape of this changed, I think, in those early conversations with you, Paul. It was a really valuable thing, I think, to kind of reconstruct that idea of what is the knowledge that we can collect through this process and through this project that's actually going to come up with solutions and answers that can help empower people within the rural communities to change the things that they can. And so I think that it kind of helped us to be able to really shift the scope of what we were thinking about in terms of research questions, to look at the access point issues and to look at how that complex intersection, really, because I guess as you get older, the physical changes that happen, the things that can change with health conditions, with disability, are things that we've always talked about a lot, and about that, how that intersection can really impact mental health in later life. It's not as clear cut as saying, I'm a younger person with a mental health condition, or I have a physical health. Like, the melding really came together. And so that, I think, really helped us to be able to shape better questions and a better kind of approach to doing it. I think I do still love, though, that the hardest learning curve was our cockiness as researchers, as we're all researchers. I think that made us fall on our face in terms of thinking that we had the answers around that, and being able and having to go back to that drawing board and come back and say, hang on, how are we going to reformat this? How can we talk to people about their mental health as an older person in a rural area without confronting the stigmas, without pushing people outside of their comfort zones, without causing challenges around privacy if we rock up with, and conduct a focus group in a rural area. And so I think that it was, for all the amazing things, and we're kind of at that shiny end now of writing it up, and it's all, hopefully going to see the light of day. But I think actually that journey of going through that project and adapting it, and adapting our approach, and kind of being able to keep coming back to that drawing board of our stream and sharing and bouncing ideas to keep the project going, so that we didn't grind to a halt. We were able to kind of, redesign and rework and look at ways to improve it. And we've ended up with a great outcome as a result. But that collaborative, I suppose, process of having a stream behind us to help form it meant that when things didn't go as planned, we had an awesome, safety net to come back and rediscuss and reapproach and to plan it. So I loved the developmental thing as our first project together, to be able to kind of see how that iterative process played out in real life when things came up in the research process.
I think this project's been a success on a number of different levels. And I can remember early on when we talked to you about it, Paul, and you said, we were talking about, the problem of limited access to health service professionals in rural areas. And you said to us, it's not just getting in the door, but when you're in the door, you have to prioritize which 2 of your 10 conditions that are all equally important you want to talk about that day. And invariably, it's the physical thing, the shoulder, the knee, whatever it may be, that's physically stopping you doing what you want to do, that bumps to the top of the list.
Yeah, and it's that extension of really taking that holistic approach and understanding that it's the physical and the mental health aspects. This is primarily focused about how do we improve mental health, and again, it's that siloed concept. Again, is that generally the conversations had, and that's all that the healthcare provider talks about, without actually broadening their horizon, saying, okay, so let's acknowledge the mental health side, but what other factors may be involved there? It's showing respect. It's moving from that, dare I say, be so bold, is that cold clinical academia biomedical model to a more person-centered, strength-based approach to say, let's look at this person in whole. And one of the key things, the key changes that we've made was respecting people in regional areas. You bring a focus group, what pressure, what environmental factors does that have on them? So that was showing respect to the people that we want to assist and help out there. So, I mean, that was a good learning curve for all of us, but that's what person-centered is about, is actually understanding the nuances of that individual. How do we get the best outcomes from them to us, and therefore we can then return that. So I mean, that I think was a very early but good turning point.
Absolutely.
And I think the funny thing about that, Dan, is that when we've actually talked about this project in academic circles, like at conferences or things like this, that's the bit that people are most interested in, more than our findings, more than the project itself. It's the process of how did this come about and how did you adapt it, and those challenges feel really familiar. We've tried to do this and we have trouble trying to get people to talk about complex things, and we were, I think that ability to be able to come back and think about it more from the experience of how do we make people feel more comfortable about this, instead of going, well, this is an efficient, great, methodologically sound way of collecting data. How can we actually put the people that we want to hear from at the heart of designing projects? And I think academics seem to be hearing and kind of connecting with that piece really loudly, to the point that a paper came out about it, Dan. But that kind of sense of, okay, I love this. I love that you guys have been able to adapt your research to better accommodate and better work with the people who you're wanting to hear from, not in spite of them, just because it's methodologically the way that things should be going. So I love that.
We got some really good receptions to being open and frank and talking about the challenges we faced along the way, and a lot of other people related to that. And I think that talks to the success of this as a standalone project. It's been fantastic for establishing a platform of working and a relationship for us and for the others that are involved in the project by proxy. It's supported, or it will by the end of it, have 3 different papers come out of the project. It's supported an honours student, it's supported an undergraduate research fellowship. So it's really ticking a lot of boxes, and it's also informed some of the future work that we're going to do that we'll talk about in a little while. One of the other collaborators that we invited into Rome through Belinda is Christy Robson down at Charles Sturt University at the Three Rivers Research Centre. And through that relationship and through Christy coming onto that project, Christy and I are now collaborating on another project which we got invited to join through HMRI, the Hunter Medical Research Institute, around community healthy aging hubs and lending Manna's health and wellbeing expert eye to that project. And I think that's an extension of the success that we're now looking to build some of the external collaboratives and being invited as Manna's health and wellbeing later life team to contribute to those projects. The capacity building has been another key thing, through whether it's in the regular meetings that Belinda and Paul both come along to, formal and informal mentorship and guidance. And we've talked about how that doesn't necessarily have to be a prof mentoring an HDR, but certainly I can look at both the people on the screen here and say I've learned things from both of them through informal mentorship and critical friends. And then that publication that Belinda was talking to, we've got another one coming along the way as well, that are really trying to inform and add to the academy about building emerging rural researcher practice, learn from what we did kind of approaches. I think it's really important to be open and honest. And we've got some great HDR students in this group as well, exploring things like rural approaches to dementia risk reduction and considering the impact of mental health and well-being there, tech-based interventions for social connection, as well as exploring some of the wider factors contributing to healthy aging in rural and remote areas. So some really big questions being asked by our HDR students who come along to those sessions and have those opportunities to pick brains of other academics, but also of Paul as our lived experience rep. So Belinda, where next? Where next for the health and wellbeing stream?
Oh, look, I think you're probably both sick of me talking about it. I'm so damn excited. Well, I guess that it's twofold, really. And to touch on what you've just said there, Dan, I think that one of the things that I think for all of us has been is a passion that underpins a lot of our decisions. Is not just about how can we do more research projects? I mean, I think what we've come to realise very quickly is that we have something really special here and we have something really unique. And so the knowledge that we can share about how to do better research that is embedded and built upon lived experience, expertise, and not just kind of academic projects. I think the more that we can try to disseminate kind of, I guess, that our experience and our knowledge and our better ways of doing things, I think we're kind of showing that co-design isn't something that happens after the fact. It's not just something that you implement in your projects. And we're kind of trying, I guess, to get our HDRs, to get everybody who's, willing to stand still long enough to listen, to kind of be better researchers, to challenge everybody out there to do better research that, with rural people and older people and people experiencing mental health conditions. And I think Manna is the ultimate environment for that. So I think that that is kind of underpinning a lot of the decisions that we're making, but it also really, the largest sort of research program that we're developing at the moment recognises that. It kind of was built out of an early scoping review that we conducted, which looked at what are some of the challenges to implementing health programs in rural areas for older people. And we started to, a lot of the things, that we talked about with you, Paul, and we bounced off around the complexity of that intersection, of physical and mental health and all of the things coming together in later life. And we were seeing that there were some really common challenges in rural implementation. Everybody has the evidence, it's great, but it's developed in a city, which is great when you've got access to public transport and a whole suite of health professionals and funding and all of the things that we don't have as our reality often in health services. And so that kind of systems piece, I think, we were starting to realise it really didn't matter how many ROMs or how many scoping reviews or how many projects that we did. The problems are the same, the implementation of great ideas falls over. And it's that system stuff you were talking to, Paul, is, it's the bigger structural things that stop older people getting good physical and mental health care in regional areas. And so the next steps, I think, for us was, what? We can stay on the wheel. We can keep coming up with solutions at project levels, or we can go back and fix the damn wheel, which is where the next project is taking us, is to really try and help look at the implementation science behind rural knowledge translation. How can we get all of this amazing stuff that we know can help people age well and have great mental health and physical health in later life, but how can we actually get that knowledge to them? How can we empower the rural communities? How can we empower older adults and their carers? How can we actually help health service providers to translate that knowledge into a way that it works in their own unique environment? We know there is no one-size-fits-all solution for rural areas, but we believe that we've got the tools and we've got the knowledge and we've got the combination of lived experience expertise. We've got an amazing team of industry partners on board with our project. So we're working together with Live Better, with Comlink Australia, both major service providers across New South Wales and Queensland. We've got the Peregrine Centre, who do incredible rural mental health work, of course, Manna Institute. We've got the AAG, Association of Gerontology, behind us to look at the policy translation piece, which was really central and something, Paul, that you've always really helped us to keep on the radar, is not just what's the knowledge, how do you actually implement at policy level knowledge? And I think that kind of, being able to have lots of key people on board, and CODA New South Wales, of course, the advocacy organisation for older adults, are central partners to this. And so being able to work with lived experience experts, with industry partners, with academics, and the incredible team of really experienced researchers at Manna, who acted as a very early shark tank to our ideas and makes it sound like they chewed us up and spat it out, but really they just made the project a whole lot better than it was going to be.
There was some chewing up and spitting out.
A little bit of chewing on the side. But to Phil Batterham, to Chris Doran in particular, were two incredible people who really have given so generously of their time and expertise and really shaped this project into being something so much stronger than what we had envisaged in our early conversations. And so I think that watch this space. We've got an application under at the moment, but quite determined to see this through, whether it's this grant or bite-sized chunks. We're fixing that system. We're going to look at rural implementation for health programs for older people.
Belinda, I think our conversations with Paul have obviously been key to not just that project, but shaping how we as a stream want to go forward. And I think the other person who was quite fundamental in the early stages of that was Matt Summers when in his role as
Yes,
CI.
yeah.
You know, he really sat with you and I and asked us again those tricky questions of, well, what do you want it to be to belong to the stream? What do you want the health and wellbeing stream to do and to achieve, and how do you want it to do it? And yeah, it came back to that bigger picture of the policies and the larger social impact compared to, well, we want to get some money and tick some boxes kind of approach. Yeah,
we want to change the world. Come on, how can we go about doing this?
Yeah. So I've got a couple more questions, one for each of you, and then we'll open the floor so everyone else listening in can start to think what they might like to ask. Paul, to you first. We've constantly heard, and we continue to hear about the need for consumer engagement from funding bodies. And to me, that runs a risk of becoming tokenistic on one hand, or of overburdening individuals on the other hand. And we've sat and talked today about how much we draw from you, and Belinda and I are very conscious about not asking too much. So how do we go about empowering more pools to be active in the research space?
Cloning.
Small question to finish.
Yes. It's a very valid one, because when we look at our society, the words consumer, the words peer worker, the words lived and living experience are the flavour of the month, flavour of the year, and hopefully the flavour of the for the next 20 plus years. Thinking about it, one of the challenges that I had very early on was this mystical cloud that sits around academia. So I come from a business background, but no formal education. So in my mind, it was like, what have I got to offer? I don't have the formal qualifications, the degrees, the masters, blah, blah. So there's this mystical cloud, which to me is needs to be brought down. And part of that is to create the awareness, both directly and indirectly, through the contacts that we have, the contacts that I have, to actually spread the gospel, if you like, to say that there is a place for people with lived and living experience. To do that, the environment, and in this case, the Manna Institute, needs to acknowledge and recognise what lived and living experience brings. In my case, it's 50 plus years of living with all those things. It's the knowledge, it's the experience, it's the insight, it's the frustrations. They're all valuable things. They may not fit with a formal qualification that sits behind it, but they are critically and valuable. So part of it is to actually acknowledge and recognise those things, so it does become inviting. We need to invite these people. We need to see that they have value that they can bring to it, and therefore provide them with a challenge. It's about giving people like myself a platform as a voice. So many people with lived and living experience, we don't know what we don't know. We don't know where to go. We want change. We definitely need change, but how do we bring about change? A lot of people, as I said, it's that cloud that sits around academia that says, oh, that's probably not going to be for me. So that's one of the things. It's about providing the platform for the living experience to understand that they can bring value as an individual, but collectively, just as we've all spoken about here. I bring my insights, but collectively that actually has a major impact there. So they don't have to stand alone. And that's sort of, I think at one of the early meetings with the Manna Institute, one of the comments I made was the balance of power, the balance of trust, and balance of authority, that sitting around the room, there's VCs and there's all the other wonderful acronyms that you guys have, your HCRs and CIOs and a GT and OT and all the rest. But there was just this equilibrium of thought and input. And that, again, is a critical thing to understand. It's a potential barrier. So how do we actually make it more inviting for these people to feel value and not feel overawed? Because it is overawing. I walk into a room and there's all these, smart people around. So it's part of that. It's, which then leads back in giving that person the purpose in terms of what they are wanting to do, what they're wanting to achieve. We don't know what we don't know. Jahari's window, the bottom right-hand corner. It's about how do we actually allow those people to move from that window up to the top left, whatever it is, that says, I know what I know now, and I know how to apply it. So it's part of that. Part of it is then going into the micro detail is, how do we recognise and acknowledge those people? There's the ongoing development of the financial rewards, and that's a key component because what we bring is incredibly important. So that is a learning curve that's going through. But things that we've spoken about is, potential authorship, potential contributor status, and there's a whole range of things that says, yes, I am being acknowledged, I am being recognized for what I bring. It's that win-win situation. They're not the major things, but they're little things along the way that encourage people to want to be involved. And it's just about pushing the barriers out there to say, who do you know that may want to be involved? Sometimes we just need that invitation because we don't know. Again, how do we get involved?
And I think it's about offering those opportunities without a set agenda, coming in and saying, it's, as you say, we're meeting as equals to have that mutual benefit, not coming in and saying, Paul, I need you to come onto my project because I need to tick the consumer box.
Yes,
and on paper, that might look great, but that's not going to get anyone benefits in the long term.
And that's about managing everyone's expectations. So you're putting that right up front to say, I need you because of X, Y, Z. So I now know exactly where I fit into the pie, not me coming in thinking, okay, they want me for all these things and go, okay, yes, as you said, I've ticked the box now. You go and be a good boy and you sit over in the corner there and that's it. Thank you very much. So it is really about managing those expectations, which then means the person or persons are more involved because they know where they fit into the equation. Sorry, Belinda, I jumped in.
No, I think all I was going to say is just really, I think, I wonder, Paul, and I don't know my observation of this, whether both of you would agree or not, but it was exactly that. We met there was no agenda other than we were just at an open space. And I think that's something that Manna does really beautifully, is the breaking down of walls, where we're all in the same room together, and it doesn't matter what your academic qualifications are or what your pay grade is or what your role is. Everybody's at the same table and everybody's voice is valued. And I think that we met and we connected because we really liked each other as people. It wasn't that we sort of went, oh, look, hi, I really want to
You'll
work
be good
with
for
Paul
my work.
because I have I've got a really gaping hole for a lived experience expert in my research program. It was, I think, just genuinely like, we connected as humans first before we had started to talk about research. And I think that was something that, for me, I think makes a difference, because we didn't start with the research as the outcome. We started with the relationship just because we liked who each other was and we were curious to find out more about each other. And we were genuinely seeing those sort of synergies come from organic conversations. Like, I guess it sounds very, but that kind of, we weren't there trying to map out a project. We were just kind of getting to know each other over a series of different planning days. And I think that helped trust, it helped a relationship, it helped a strong foundation that when we did come back and say, hey, there's this research stream now, how do you feel about being part of this leadership crew? How do you help us to do this? How can we help you to make sure that your interests and needs can inform our agenda? Like, what does this look like? It wasn't, and I know, Paul, I've joked often with you about not being an ask hole in terms of how much I reach out and go, Paul, I need to Zoom you. I've got a thing. And so I think that it is, how do we understand also that as academics, our brownie point systems from publications are not the same thing that rewards and values a person who is coming with lived experience expertise. How can we make sure that it's not just us meeting academic objectives and needs? How can we actually make sure that the rewards are there, I think, also for people with lived experience expertise, and recognizing that that's going to look different for every person and what they need and what that might look like. So I don't know. I love those early conversations. I think it's certainly made for a much stronger team.
It's a valid point for all people out there today, and and for any research project is it goes back to my old corporate days. Is when you're putting a team together, and I'm going to age myself by saying, if you looked at bringing a project team, you went and did the DISC profiling. If you've got all Ds, then you got lots of problems. You got all Is, you got problems. You got all S's, you got all C's. So part of this is saying, what are the key holes, or what are the key skills that I've got? What are the holes that I don't have? How do I fill that? And who are the types of people? That's what makes a successful team. It's the same thing with research. That's where the lived experience comes in to say, hey, they're going to bring a totally different viewpoint, insight. They're going to challenge some of our things, the way we think, the way we act, how we source information. So again, for young aspiring researchers or any project team, it's about looking at who are the members of the team, what are the strengths, what are the white spaces that we have, and how do we that then allows you to go out to the market. But again, it's about managing expectations, because you're actually going to these people and say, we'd like you to be part of our team, and this is the role, this is the area. We want more than that, but this is specifically why we want you as part of the team. So I mean, it's a good learning curve for all people when it comes to teams.
Absolutely.
Look, Paul, thank you for the perspective you bring us and the work, the time and the energies that you provide to our stream. I hope everybody can see how invaluable to our work it is. Recently, it was Ageism Awareness Day, and we had a joint viewing webinar here on the Sunshine Coast. And the quote that stood out to me from there was, one of the presenters said, we want to be recognized for who we are now as a person, not who we were, not who we're going to be, but who we are now. And I like to think that the involvement and the things that you bring to this stream and the way that we model how you can have real impact in our stream, it helps show to do that. And I actually think that Manna really shows a platform and a pathway for how lived experience can be embedded in research projects. You know, the irony is, of course, that the MRFF and the NHMRC and the ARC want consumer involvement. So you're asking for the money to pay the consumers, but they want the consumer involvement at the front end. So yeah, you know, and I think Manna shows a way that that can be achieved, thinking slightly differently and get stronger projects at the end of it. Belinda, just before we reach our closing time today, you've seen this stream and Manna as a whole grow. Can you talk briefly about what you got out of being a Manna researcher? How has it helped you to grow and develop as a researcher and as a person? Giving you a small person to finish as well.
Yeah, I think I feel like I've spoken to a couple of these things, but really
Yes,
it's that it's challenged me. It's making me a better researcher. And I actually think what that is it's about like-minded people. You know, Manna really does. You can be within your own institution, within your own profession, doing your work. But when you actually find people who truly committed to doing other place-based research, who understand the uniqueness of rural areas and who are trying to tackle similar problems, who are equally committed to actually embedding lived experience and industry and community and First Nations voices, and making sure that we're not just doing that academic siloing. I feel like, you know, Manna has created a space that has encouraged me to feel like it's possible, you know, and then to be able to actually provide the infrastructure and support and the access to the amazing people who have made it possible to do better research, to do better place-based research, to do better collaborations, to partner right across the regional universities network, to partner right across industry and lived experience and First Nations domains with a lot more confidence than I would have done if I was just still here in my own little kind of bubble, I guess, as a researcher. So I think that it's really just letting me do the things I'm so passionate to see happen. I think it's provided a space with other amazing people who think and feel and see research in the same way that I do, and I love that.
Thank you. I would echo all of those things. And does anybody have any questions for our panel here today? While you're thinking, I will reflect back on a couple of weeks ago. Chris, you've popped straight in there. What can the health and wellbeing and later life stream do to strengthen the evidence base for aged care in rural, regional and remote Australia? Great question, Chris.
I think we're doing a few things at the moment, Chris, in terms of Manna and this stream has actually helped to give a different platform to some of the research that we're doing with that rurally specific lens. And I know, just thinking about some of my own projects and tenders and things that I'm being invited to be a part of, specifically because people want that rural mental health lens to be a part of it. So I think things like we're currently rewriting the clinical guidelines for how to navigate dementia, and sitting there, you know, with teams of geriatricians or who are all asking these questions, and I'm going, but how does that work in a rural area? But how do you implement that? But how do you? And so I think being able to kind of be an active voice who is getting ourselves invited to tables now where we can actually really advocate as the development of things like new clinical guidelines is happening, as evaluations of the way that psychological services in residential aged care facilities is one of the other projects I'm doing. And, you know, these kinds of things, I think, giving us the coming together as a stream is giving us a stronger platform from which we can actually engage with other people's projects as well, to keep that rural voice on the table. And so I mean, look, hopefully getting the funding will for this project would be a fabulous major step to building our own evidence base. But I think it's even just in that invitational kind of level where we're there, we're at the tables having these conversations, keeping rurality and ageing on the agenda.
I think for me, Belinda, it's also about expanding and providing that expanded network, that network of networks, if you like, you know, rather than before Manna, I might have been able to do a project looking at home-based aged care in Southeast Queensland, and you might be doing exactly the same sort of thing down in Albury-Wodonga, but together and through some of the other members of our team, we can do a project that spans the east coast of Australia, for example, and you know the reach, the depth of perspectives that we get from that sort of project are so much richer because of that.
Yeah, great point.
Could I just add there that it's also about expanding that network, and it's not just sticking to the ones that we know. It's like, you know, part of what I do, one of the takeouts that I have is that with all the different committees that I sit on, I take this and I go to, you know, the Australian Frailty Network. Okay, you guys should be working with Manna on this because there are some key things that, you know, you're working on dementia, you're working on this, you're working on that. It's about going to regional service providers, in this case, aged care. So what are the nuances that regional aged care providers are struggling with, and being able to reach out to those, whether it's, you know, like I threw in the Country Women's Association, National Farmers Federation. I mean, they're all key regional organisations which normally don't sit on our radar. So it's about opening that radar as to, you know, how and who can we actually tap on the shoulder and say, hey, we would value your input, because again, that's a win-win, because you got two parties that probably wouldn't normally talk to each other and now working towards a common goal. So that's one thing that Manna has started to do, very much the embryo stage. It's certainly what this project has done. And I know the three of us have had quite a few conversations about that.
Paul, I think there's a real tendency to think a lived experience expert would bring their experience of their mental health work or whatever it might be. But I think you've just shown us there in your answer that the different perspectives and the reach of you as a member of our team extend far beyond just that lived experience of your condition, you know, to say, well, I can be the person that connects you to people in the Australia and New Zealand Frailty Network is, you know, that's not something that you might expect a lived experience person to bring those sort of things. And, you know, a journeyman like yourself who wears a few different hats can bring that to a team as well. Yeah, it expands that network of networks. And Chris, I fully agree with the comment you put, given the aged care reform and the changes that are coming, that everybody wants. It's not a government policy. Everybody wants that shared thing to live in place and age in place, whatever it is, longer. Just this morning landed in my email inbox, Regional, Rural and Remote Home Care Workforce Support Programme, a forecast grant opportunity. So really timely question, Chris. Thank you very much. And we've probably got time for one more question if anybody has one.
While we're waiting to see if somebody does have a question, I think Paul and Dan, what you've just said there about that idea of not just bringing lived experience, expertise in relation to the experience of having lived with a mental health condition, it kind of makes me think a lot about ageism and a lot of the challenges we have, don't we? Where we see this a lot in our research and within this stream, and is that problem around people are kind of suddenly put in a box like, this is an older person. It's like, no, this is a person, full stop, who has actually lived a really long and full life. And this isn't just about getting the perspective of a person because of their chronological age. That's not what this lived experience is about. This is a whole person who has so many different things to bring. It's no different to somebody at every other age group. And so I often wonder why we do that. We think about lived experience as being something, whereas your corporate kind of background, Paul, I think has been a saving grace to the kind of health, you know, professionalness and the airy-fairiness sometimes that, you know, we can bring up Dreamscapes. You have a really strong corporate knowledge about operationalizing things. And so I think that I think whenever people are thinking about the idea of working in partnership with somebody who's bringing their lived experience expertise to their research, whether they're as fortunate as we are to have that at a stream level or even at project levels, think about the whole person, you know, not just thinking about what part of their lived experience in relation to this specific topic is coming here. Like, be open-minded, I think, to the possibilities that the answer to that question could be really broad and really enriching to who you are as a team and the directions that you will take. don't just think about lived experience in relation to an issue or an experience, I think, which is something we do with age, we do with, various conditions. So
I think, as Paul said, it's about what can that person bring to your team. Not just lived experience might be one thing they bring, but it's not going to be the only thing they bring. And
the whole person.
We hear a lot in rural and remote people have to wear multiple hats, and I think the more we build research capacity in those rural settings, the more we're going to see lived experience individuals and researchers being one and the same, because people will bring both of those different hats and consider things from those perspectives. But that doesn't mean that anyone else's input is going to be any less important and valuable in that space.
Can I just say also, there's one area that we've spoken about, and I think it's an evolving idea, is that when we talk about aging, we talk about aged care and how we approach that, the conversation is usually focused around postvention. So what are we doing now that you've reached that stage? And one of the insights for me, but I know based on the conversations, and this applies, mental health, physical health, all types of things, is that there's three types of intervention, as we know. This is postvention, intervention, prevention. So one of the learnings from all of this is, what are the things, what's the data, what's the learnings that we can take to actually now implement those back into the intervention? How can we put that into prevention so that when people go through that journey of life, it's actually more enjoyable, it's more beneficial for them, which ultimately is a less financial strain on the health system because they're in a fitter, stronger state. So, I mean, it's a byproduct of what this project is. And I'm sure there'll be quite a few other potential projects that will flow out of that. But that's one of the things that I've taken, is that historically, we all focus, in this case, on the postvention. There's so much more that we can do to actually ease the pain, ease the physical pain, ease the financial pain, the government pain of having to fund and find these things. And hey, if we can save 20, 30, $40 million and not have royal commissions, and that's a good outcome.
Yeah.
We already know that people are aging with really disproportionate disadvantage in rural areas. They're already coming with higher rates of chronic health diseases. They're already coming with a lack of access to services. And so that whole of life course approach, I mean, maybe that's something, Dan, Paul, we should add to our agenda for the future of this stream. Let's take over the child, youth and family stream as well. Let's start early with our planning.
Well, we do need to. And I was going to extend the collaboration and proxy answer to Chris in that sense, that I think part of what we need to do as a stream is also look to collaborate across the other streams at Manna. And as you say, Belinda, recognize, some of the work I do is in the intergenerational space, and recognize the value for both different parties that can come from that sort of project. The physical health, the healthy people, healthy planet, there's so much intersection across those streams. Distress and suicide prevention, that's got a really clear alignment to what we're exploring in our own project. Thank you very much, guys. It's been a fantastic discussion today. If everybody's interested in those other streams, you're welcome to pop onto our Manna website and explore each of those and see how you might get involved in any of them if you're not already. You'll also get a chance to hear about the fab work that all of our streams are doing at the Manna Symposium, which is being held in December, from the 4th to the 6th of December in Sydney. This year's theme is Branching Out, Growing Rural Mental Health Research. Our next webinar will be in 2025, where we're going to hear from one of the other Manna research streams, and each of those will be invited to talk, as we've done today, across the course of next year. So thanks very much for attending, everybody, and we look forward to hearing from you soon.
Thanks for your excellent chairing, Dan.
Yes.
You're most welcome.